Several painkillers, if misused or taken in excess, can potentially cause liver damage. Here are 11 painkillers commonly used by Americans that, if not used appropriately, may lead to liver damage. 1. Acetaminophen, which is commonly sold under the brand name Tylenol. It's generally safe and effective when taken correctly. However, there's something really important to know about it, especially regarding your liver. You see, Tylenol is mainly processed by your liver. When you take Tylenol, your liver works hard to break it down and get rid of it from your body. Taking too much acetaminophen can lead to a condition called acetaminophen overdose. This can be really serious because it can harm your liver. Symptoms might start off mild, like feeling nauseous or throwing up, but they can get worse and even become life-threatening. That's why it's super important to follow the recommended dosage instructions on the label and not take more acetaminophen than you're supposed to. Also, be careful not to take multiple medications that contain acetaminophen at the same time, because that can add up and increase your risk of liver damage. 2. Ibuprofen. Commonly sold under brand names like Advil and Motrin, here's how it works. Ibuprofen is part of a group of drugs called non-steroidal anti-inflammatory drugs. Firstly, ibuprofen metabolism primarily occurs in the liver. Prolonged or high-dose usage can overwhelm the liver's metabolic capacity, leading to the accumulation of toxic metabolites and placing undue stress on liver function. Secondly, ibuprofen has been linked to causing hepatic inflammation and necrosis in some cases. Although such instances are relatively rare, prolonged usage or consumption of high doses can increase the risk of liver damage. Hepatic inflammation compromises the liver's ability to perform vital functions, including detoxification and protein synthesis, thereby predisposing individuals to liver diseases. 3. Naproxen, commonly sold under brand names like Aleve. While widely used for pain relief and reducing inflammation associated with conditions like arthritis, menstrual cramps, and headaches, naproxen can pose risks to the liver if not used appropriately. The liver plays a crucial role in metabolizing drugs, including naproxen. When taken in excess or over a prolonged period, naproxen can overwhelm the liver's capacity to process it efficiently, leading to potential liver damage. Excessive use of naproxen may result in hepatotoxicity, a condition characterized by liver inflammation or injury. Symptoms of liver damage may include jaundice, yellowing of the skin and eyes, abdominal pain, nausea, vomiting, fatigue, and dark urine. Individuals with pre-existing liver conditions, such as hepatitis or cirrhosis, are at heightened risk of experiencing liver damage from naproxen. 4. Aspirin, like many medications, it carries the potential risk of liver damage if misused or taken in excess. Liver damage from aspirin typically occurs in cases of overdose or long-term use beyond recommended dosages. Symptoms of liver damage may include jaundice, yellowing of the skin and eyes, abdominal pain, nausea, vomiting, fatigue, and dark urine. Individuals with existing liver conditions, such as hepatitis or cirrhosis, are at increased risk of experiencing liver damage from aspirin. Moreover, combining aspirin with other medications that also stress the liver or consuming alcohol concurrently can further elevate the risk of hepatotoxicity. 5. Diclofenac, marketed under the brand name Voltaren. When taken in excessive doses or over a prolonged period, diclofenac can strain the liver's capacity to process it efficiently, potentially leading to liver damage. Hepatotoxicity, characterized by liver inflammation or injury, can result from prolonged or excessive use of diclofenac. Symptoms of liver damage may include jaundice, yellowing of the skin and eyes, abdominal pain, nausea, vomiting, fatigue, and dark urine. To minimize the risk of liver damage associated with diclofenac use, it is essential to adhere to prescribed dosages and usage instructions provided by healthcare professionals. 6. Ketoprofen, sold under the brand name Orudis. Excessive consumption of ketoprofen can overwhelm the liver's metabolic processes, leading to liver inflammation or injury, a condition known as hepatotoxicity. Symptoms of liver damage may include jaundice, yellowing of the skin and eyes, abdominal pain, nausea, vomiting, fatigue, and dark urine. Individuals with pre-existing liver conditions, such as hepatitis or cirrhosis, are particularly susceptible to experiencing liver damage from ketoprofen. Furthermore, combining ketoprofen with other medications that stress the liver or consuming alcohol concurrently can further increase the risk of hepatotoxicity. If individuals experience symptoms indicative of liver damage while taking ketoprofen, seeking prompt medical attention is vital to prevent further complications. 7. Indomethacin, marketed under the brand name Indocin, is commonly prescribed for the relief of pain, inflammation, and fever associated with various conditions such as arthritis, gout, and bursitis. While effective in managing these conditions, indomethacin carries the risk of causing liver damage if not used appropriately. The liver, being the primary organ responsible for metabolizing drugs, can be adversely affected by high doses or prolonged use of indomethacin. When consumed excessively, indomethacin may overwhelm the liver's capacity to metabolize it efficiently, potentially leading to liver inflammation or injury. 8. Celecoxib, marketed under the brand name Celebrex, primarily used to manage pain, inflammation, and stiffness caused by conditions such as arthritis and menstrual cramps. While effective in alleviating these symptoms, celecoxib has the potential to cause liver damage if used improperly or in excess. Excessive consumption of celecoxib can overwhelm the liver's metabolic processes, leading to liver inflammation or injury, known as hepatotoxicity. Additionally, combining celecoxib with other medications that stress the liver or consuming alcohol concurrently can further elevate the risk of hepatotoxicity. 9. Tramadol. A synthetic opioid pain medication is prescribed to alleviate moderate to moderately severe pain. Liver damage associated with tramadol use typically occurs under certain circumstances. Firstly, tramadol metabolism occurs primarily in the liver, where it is broken down into various metabolites, some of which may be toxic in high concentrations. Additionally, tramadol's metabolism can be affected by individual factors such as liver function and the presence of other medications metabolized by the liver. Moreover, tramadol's combination of effects on opioid receptors and serotonin and norepinephrine reuptake can increase the risk of adverse reactions, including hepatotoxicity. However, it's important to note that the risk of liver damage from tramadol is relatively low when the medication is used as prescribed and under medical supervision. Patients should adhere strictly to their prescribed dosage and duration of treatment, and healthcare providers should carefully monitor individuals with pre-existing liver conditions or those taking other medications that may affect liver function. In summary, while tramadol can be an effective pain management option, patients and healthcare providers must be vigilant regarding its potential for liver damage, especially in cases of misuse, overdose, or in individuals with compromised liver function. 10. Ketorolac, commonly known by its brand name, Toradol. While ketorolac can be incredibly helpful in relieving pain, especially after surgeries or due to certain medical conditions, it's important to be cautious. Like many medications, ketorolac can potentially cause harm if not used properly. One of the risks associated with ketorolac is liver damage, particularly when it's used for extended periods or in high doses. You see, the liver is responsible for breaking down ketorolac, and overloading it with these drugs can strain its capacity. For people with existing liver issues, using ketorolac can be even riskier. That's why healthcare providers always monitor liver function when prescribing this medication, especially in patients with liver conditions. In essence, while ketorolac can be a powerful tool for managing pain, it's crucial to use it responsibly, following the guidance of your healthcare provider and being mindful of its potential effects on the liver. 11. Opioids, including medications like hydrocodone, Vicodin, and oxycodone, OxyContin, are potent painkillers that many people find intriguing due to their ability to provide significant pain relief. However, there's an important aspect of these medications that demands attention: their potential to cause liver damage. Let's delve into why this happens. Opioids work by binding to specific receptors in the brain, spinal cord, and other areas of the body, effectively altering how we perceive pain. While they can be highly effective in managing severe pain, opioids also carry risks, particularly when it comes to the liver. The liver plays a critical role in metabolizing opioids. When you take an opioid medication, your liver goes to work, breaking down the drug into various byproducts that can be eliminated from the body. However, this process can put stress on the liver, especially with long-term or high-dose opioid use. In addition, some opioids, particularly those that contain acetaminophen in combination with the opioid, such as Vicodin, can pose an additional risk to the liver. Acetaminophen, when taken in excessive amounts, can cause liver damage on its own. When combined with opioids, the risk of liver damage increases, particularly if someone takes more than the recommended dosage. Individuals with pre-existing liver conditions are particularly vulnerable to the potential hepatotoxic effects of opioids. Therefore, healthcare providers must carefully monitor liver function in patients prescribed opioids, especially those with underlying liver issues. In summary, while opioids can be valuable tools in managing severe pain, it's essential to use them judiciously and under medical supervision to minimize the risk of liver damage. Always follow your healthcare provider's instructions and promptly report any concerning symptoms or side effects. It's important to use painkillers as directed by a healthcare professional and to be aware of the risks associated with their use, including potential liver damage. Always follow dosage instructions and consult a doctor if you have concerns about medication safety or liver health.